All right, welcome back to the show. And because it is September of 2025, we're going to be talking a lot about AI this year and or the rest of this year. So I happen to meet Julia, correct?
Yes.
Sorry, I didn't know if I was Juliana. I apologize. I met Julia on LinkedIn, and I say met, meaning I saw some of her posts. I interacted with some of her posts. They show up in my feed now, and I've really enjoyed the content she's been sharing. And I reached out to her and said, "Hey, you want to be on the podcast?" And she said yes. So I'm going to let Julia introduce herself. She is in the AI space. Yet what I like is she's from outside healthcare, as I like to say. So Julia is going to share her story and tell us what she's doing in AI, and then we're going to talk about the value of AI in healthcare. So welcome, Julia.
Well, thank you, Jerry. Very nice to be on the show. So, give you an introduction of myself. My name is Julia. I actually has been in healthcare IT for the past almost 30 years. It's been a long time. I happen to be in this field, and as long as I am a technologist, I'm in the healthcare industry.
Yeah.
So
So
I
just
see
for
a lot.
context, real quick, I said you're not in healthcare. So
Yeah.
what I should say, you're not on the provider side. I'm on the provider side. It's so many people on the provider side. So let's just say, I apologize, people outside of the provider side. So just for context.
Yes. So I have been working in a lot of payers, health plan, as well as some of the provider group as well. Being a technologist, I see a lot of challenges from the big companies, the Fortune 5 companies like United Healthcare, to some startup and anything in between. So
It's awesome.
different organization had some different challenges, but regardless, everybody we all trying to make the best out of this new technology era and trying to see how we are going to really address the challenges and move forward. So I have been the head of product. I build a lot of healthcare solutions, and I utilize AI, especially during pandemic, and to see the truly potential of what AI can do for our healthcare as well as to improve organizations' balance sheet. And later on, I trying to help value-based care and build solution, which is utilize AI individualized solution to improve patient outcome and also providers experience. So I see it firsthand what AI can help organization, and also at the same time how organization adopt AI and to make it the best solution and the most to realize the most potential. So a lot of things, in a different area that I think I can share to help the
Yeah.
organization who really want to utilize technology and to make the best out of it.
Yeah, that's awesome. Thank you for sharing that. We you do have to share one more thing you shared with me before we hit record because I'm not going to allow this to go any further till you tell people what's the last mountain you climbed.
So basically, at the same time, I'm a technologist. I have a life outside work. So I have very much enjoyed being outdoorsy and dynamic. So I have been athletes pretty much all my life and staying fit as long as I live. This is my goal. I'm a rescue diver. I love ocean. I do free dive from time to time. And I also, being a mountaineer, recently I do rock climbing, ice climbing, and recently moved to a little higher mountain, doing big mountaineering. So I climbed a few 8,000-meter peaks, one of them being the tallest mountain in the world, Everest. I summit Everest 2022, May 25, 2022. So it's a great experience. So I
That's
feel,
awesome.
oh, thank you. I feel lifestyle is also very important while we, trying to make the best out of being healthy.
You know, it's funny. You just made me think of something real quick, a little tangential here. If you free dive, you've been on the tallest mountain, but you've been down very far. So I want to feel like you've seen right from top to bottom more than probably most people on the face of the earth. That's pretty incredible. When you say you started free diving, I went, wait, she's gone the other way too. She's gone up and she's gone down. So you've seen a
Yeah.
lot vertically. You've seen a lot of this world.
Yes, and I
That's great.
feel with nature is one of my things. Really, kind of for me is mental reset, I would
Yeah,
say,
right. Yeah.
and really see things in a bigger perspective, and knowing that life is very fragile and at the same time so beautiful. How to cherish each moment and trying to make an impact out of it.
I love it. I love it. So much good stuff in that intro, including that. So, why don't you, you mentioned, I took down some notes already in the space you've been in. Let's walk this back a little bit, maybe if you don't mind, and a little higher. Um, look, what if, so this technology has grown faster than anything else. If you look at a timeline of like the automobile and then jump forward to televisions and then jump forward to the internet, even things like that, this technology is growing at a rate that we've never seen in our lifetime. Would you agree?
Absolutely. So it very much resonate with my today's post. Basically, for million tokens, it used to cost $10,000 6 years ago. Now it costs less than $1. It's almost like 10,000. It's almost like 6 years ago. You buy a used car. Now it costs less than a latte. So I
Yeah.
feel it's really the speed of AI right now. That's why I keep up with the AI news every day, because every day can be different. Every day things comes out. Every quarter, the top three companies, they keep changing positions. Who
Yeah,
has the
right.
best market share? And this it's a whole spectrum of things. It's especially in the epicenter of AI here in San Francisco and Bay Area, and attend all these events every single day. I feel it's not just moving fast, it's from idea on napkin to reality. It can happen, in a matter of days. So
Yeah.
hackathon, especially. So a lot of brilliant minds in this location as well. The whole vibe of doing things with AI is out of this world. It's absolutely the best. Best
Yeah.
time, best
I,
place.
yeah. To be honest, so this is funny because between you and I, we're on different ends of the spectrum here. I mean, I basically discovered, I'm just going to say discovered AI about what, 9 months ago. And when I did, I believe I saw a couple things. I saw a great future, yet there was some fear involved. In the fear was involved of how is this in what I do? How is this going to impact me both positively and negatively? So I've spent a lot of time and why reaching out to you. I want to learn more. I want to talk to people who know a lot more about this than I do is right. But there was the positive, but there was the fear. So let me ask you this question. We're both in healthcare. You mentioned a lot of things working right on both sides of the spectrum, driving better outcomes for patients, I would like to say if we're driving better outcomes for patients, I mean, the name of the show is what's best for the patient is best for business. So if we're driving better outcomes, then it should be better for the business. Yet, yet just for a little context, you've worked both sides of it. What,
Mhm.
let's start. I want to get the big 900-pound gorilla out of the room. Let's start with a negative side that you see in healthcare. What should someone like me be worried about that wants to bring AI into healthcare, into the space, interacting not only with providers, but with front desk people, but always knowing there's going to be a patient or potential patient in that conversation or in that workflow? What are some of the things we need to worry about?
I think things worry might be a different word. So I'm going
Okay,
to replace the opportunities. Okay.
there
So
you go.
there's some area of opportunities that definitely we can use AI. The first thing is uh, AI is not just about tech. So for a lot of healthcare company I have been working for, and I feel the first thing is it's very important for people to understand AI is just a tool. It's a tool in the whole toolbox. Maybe it's a little bit fancier. It's a little bit newer. There are a lot of area is unknown, but in a nutshell, at the end of the day, it's just a tool. So it's very important to figure out what is the most stressing problem in your organization that AI can help resolve. So I always start a conversation with my business everywhere I go. Is like, if you have this magic wand, what you want to resolve in your area that can help the most with technology, and they will tell me. And with that in mind, that I will tell them how we can resolve that with a combination of technology, AI, automation is very important. So what end of the game with these tools, what is going to look like? So if we see the picture of where we're going and they know what we have right now, it's very easy to adopt AI as a technology. And second phase is, okay, when everybody on the same page say, yes, we want to do AI, and let's do it, so we can go to that really beautiful, and space. So then you have to do assessment. Are we AI ready? Do we have guardrails? What is the measure for KPIs? What is our data? Where is our data? Are they siloed? Are they together? Are they good quality? Do we have a data governance program in place? How are we going to train our model? What is our manual process? Are these manual process ultimately generate the I would say expected results? We don't want to automate maybe an inefficient process, but more of an efficient process. So a lot of questions you have to ask within the organization. What is our absolutely must-haves? What is unnegotiables? So these are our bottom line principles that we cannot sacrifice no matter what innovation brings in. So a lot of things we have to ask ourselves to do AI assessment. So that is basically what I have been doing pretty significantly in the past experience. Make sure you have everything in your hand and everybody on board to know what game we get ourselves into. And every step of the way we measure, are we there? Are we successful? If not, we pivot.
Yeah, I've already learned some of that, and I don't even know, right? I didn't, understanding the question to ask, right? Sometimes, again, I think we're on a journey right now where even when people want to get involved, we don't even know the right questions to ask, right? Because it's so new, it's right, and learning about it. With that said, and I think you covered that a lot. Just the things I want to take out of what you just said. What is the best way? Because see, this is why I like your content on LinkedIn. I read it at a level that these are things I need to start. So when I read your posts, it's not so much I'm going, woohoo, I got an answer. I think I leave your posts with more questions and the questions I need to be asking. So I love you just said that, because honestly, we don't know the right questions to ask. And that's probably why I reached out to you. What are, you said a lot of things in that post. You want to break any of that down? You want to talk any more about that? What you just described, that whole process?
Yes. So basically, this is something to do with my observation, not just my previous experience when I was working in healthcare industry, but also my observation when I come here, experience this firsthand of how fast AI goes, and also see how everybody is trying to hustle and catching these AI waves, in between. And some of the business, how they adopt AI so fast, and some are not. With all these observations, I try to educate more of letting people know what are some of the things that you can do, what are some of the challenges you will meet, and what is solution of those challenges, and trying to make sure that people who have some, I would say, being skeptical and how they going to adopt AI, because these days is people who use AI is going to replace people who don't, right? So same thing with organizations, how fast they adopt AI, and they will have better, larger market share than those who do not. And I really want to support small and medium organization while they don't have sufficient technology budget, and at the same time, they really want to survive, and I want to give these knowledge to them and let them know, AI is not very daunting. It's you can do very fast, very significant impact in a very short period of time, and here's why and here's how. So this is what I trying to do in my LinkedIn posts, is trying to help those small medium organization get on board.
Yeah, I love it. That's good stuff. Let's move over to healthcare now, if you don't mind. Um, we spoke a little bit. I told you a little bit about me before we hit record, and I heard something I liked, which was I agree with you. So when people agree with me, I like to talk about those things. And a lot of it's my biases and my beliefs, and I acknowledge that. So I'm constantly testing that and seeing, is this real? But we talked a little bit. You've worked, like I said, on all kinds of projects, for different, shall we say, stakeholders in this whole journey. I
Yes.
mentioned that I thought the greatest value of AI in healthcare was outside of the provider space. Can you tell me what you think about that statement?
Interesting. I have to say AI can help different area. It
Yeah.
depends on what is your true pinpoint.
Mhm.
For provider, I see some really success story as well. So a lot of provider, they have trouble doing a lot of admin work.
Mhm.
They have to, especially with EMR situation, a lot of things, they have not understand or does not have time to really understand what is the information. The patient information are very siloed. They come from different area. A lot of time they see patient first time, but they don't have enough time to really understand what this patient needs are and how to talk to this patient, what exactly holistically see the information, how these information come together and tell you a true story instead of looking at them in a silo manner. So these are the things that AI can help. Basically, AI can gather all the information together while you're sleeping and give you a high level of summary and also include pro tips, and then give you kind of like a 1 minute read before you even see this patient, and then
Exactly.
saying these
Yeah.
are some of the things that we can borrow, and then doctor will decide. And from that small period of time, doctor will, from knowing this patient almost nothing to knowing it fairly well. So I think that's one way. Second way is during interview or during, once they see the patient, and there's the ambience, there's the AI agent listening to the conversation, translate it into text, pick up the keywords, upload to EMR, hopefully automatically with the, just an overview with a patient, with a doctor, all office staff, and then click say upload, so that's during visit, right? And after visit, there's claim adjudication, a claim submission, how we're going to prevent a rejected claim, all these things, AI can help and make sure that, avoid common mistakes, give pro tips on what kind of, all these codes, ICD-10 and CPTs, and even include Medicare Advantage organization, which is HCC. Some of the things are underlying. So all these information, it's very overwhelming information. AI agent can help. So all these things are truly empower physician. And talking about for patient, there's even more individualized care, coordination of care, how we can schedule time more properly, and communication, how we're going to engage patient in the communication. These are just a couple of ways to really improve patient experience as well as physician experience.
Yeah. Wow. That I love that whole breakdown. I haven't heard that, right? I haven't heard someone break it down like that. In my journey, in this healthcare journey I've been on, right? In it prior
Mm.
to AI, this is the way I always approached it, right? What needs to happen before, and which you just broke down.
Mm.
And you broke down very well with examples. What needs to happen before someone arrives to see the provider so that the provider will be set up for success. And so where
Yes.
my world lives mostly, now mind you, I've been in the provider space, so I would say this is a value because I remember being in that space and knowing things that, man, if I would have had this before, and by the way, like you said, 1 minute before, 5 minutes before, it would have made for a better, I'm going to say better conversation, right? Which means
Yes.
probably more efficient conversation. My whole thing is giving the providers the time back in the room.
Mhm.
So, we can say, oh, I don't have enough time. I don't have enough time. But if I gave you the same amount of time, but gave you this much information before you walked in the room, then I see that as the provider can do, and I'm going to say this broadly, a better job in the room by giving them that information before and not leaving them to find out for themselves. So
Yes.
I've seen so much impact pre-AI in this space of delivering better information to providers and watching the data change, watching patient results change. And what you just described is my new favorite word, which is patient engagement, because that whole journey that you just described from before they show up to when they show up to afterwards and then the patient. So you described 4 different things there, and I love it.
Hmm.
That is a patient engagement strategy. And I truly believe AI is going to be a significant, shall we say, partner in that patient
Game changer.
engagement,
Yes.
right? It really is. Yeah.
Yes.
So that was
I'm
great. I
very,
really
very
appreciate the way you broke that down.
yeah. Thank you.
So tell me some of the, if you don't mind, let's go deeper now. Tell me some of the
Mhm.
work you've done in any of that space. I'd be interested to hear in any of that space what you've done to help with workflows and systems and processes with AI.
So more or less, without getting into too much detail, some of the
Sure.
companies I sign NDA. So what I just described from end to end, from I would say omni-channel, patient engagement, communication, smart scheduling, claim denials, and also trying to we call revenue cycle management,
Yeah.
and also manage. Patients of holistic experience using ambience upload, and also pro tips and telling them how we're going to utilize the code well and use HCC analytics better, and how we can going to find some hidden informations. So all of them is my previous experience.
Yeah, I
It's
love
not
it.
just yeah, but more of my experience.
Yeah. So have you worked with, here's the interesting part of that. And I'm not asking you to disclose your clients, so don't worry about that. I just want you to
Mm,
speak to your experience. Have
mm.
you worked with one client on all of that, or have you worked with separate clients on those
Yeah.
individual, what I call phases? I call those phases of a journey, right?
Right, right. So I'm just very, I would say, lucky to be able to expose to all different settings
Yeah.
in my past years of experience. I would say from startups to medium-sized companies to
Hmm.
really large organizations. So different area, different challenges. So what I come up with is just you have to figure out what is the pain point and then get on it, and finding the right tool is not other way around. So business
Oh, right. Wait, I
oh,
want people to hear that again. I want people to hear that again. You find the pain point, not the tool, right? Because everybody's going, oh, I got to get on AI. And it's like, to do what? Well, I don't know, but I got to get on AI. And I'm like, well, you better figure out what you need from it, right? Want from it.
right, right, absolutely. So you have to say what exactly is going to be our most the biggest problem, biggest challenge that we want to make a difference. And then the technology is AI, the right technology.
Yeah.
So most of the time might just be automation. Even within automation, some of the things
Right.
can be addressed without AI. And some of them might be just a process. Some of them might be just training. A lot of things, I feel like domain knowledge is very important. And with domain knowledge, things cannot be tribal knowledge, right? So a lot of things has to write it down, documentation, everything, anything has to be shared and has to be digested, has to be, I would say, updated with the time, and to make sure that a whole holistic organization knows what we have, what is our IP, what is our domain knowledge, what we do better than other competitors. So those are a lot of things. Sometimes It's a foundation. And even we use AI means sometimes we use AI to build our knowledge base, means local chatbot. So we can create a local chatbot for any organization, just Q&A, right? So people new, especially new employee coming on board, instead of finding the documentation on drives and different folders, they can just ask a chatbot, local chatbot, and then saying how to do this, what is the procedure, what is data behind the scenes. Everything is just simple Q&A. And moving forward, I feel even reports can be built by Q&A. So a lot of large language model, it just asks questions and they answer with a reporting format. So a lot of things that we can build upon can be low-hanging fruit and can drive results right away.
So much good stuff in there. This is great. Oh man. You know, I do want to address this one thing because we keep saying, you know, well, here, let me back it up and you can tell me your thoughts on this. What I'm seeing is right. So I'm at my physical therapy conference last year, and I'm seeing some AI people there telling you they can solve a problem. So this is the part I want to challenge the listeners on, not you, but challenge the people listening to this. I always say, okay, tell me the problem you want solved. And they say, well, I want to solve cancels. And I go, what do you mean by solve it? Well, I need something to fill, because there's a lot of AI out there that will fill empty slots for you automatically. And so people say, that's my problem, is filling the empty. Sorry, they don't say I want to solve cancels. So here's the tip, right? They say, I want to fill empty slots. And I say, well, how about we use AI to prevent the cancel rather than fill the slot? So what I want to challenge the listeners on and the people in healthcare is, when you look at the problem you believe needs solved, and I think you alluded to this at the beginning, you did a great breakdown of how you work with clients. This is the problem we want solved. Well, now we got to step it back and talk to everybody in the room is, how do you view this problem? Because, right, I have a lot of clients who have arrival problems. Oh, we have a 20% no-show rate. Well, having an AI bot to fill those no-shows is not the problem we want solved. We got to, because I believe AI, by the way, I believe AI can be used further upstream to facilitate someone showing up also, right? So to me, the real problem to be solved is, how do we get people to arrive for their first visit, not how do we fill a no-show. So I want to challenge people in healthcare, and a lot of times you look at claim denials. Well, it's just a poor intake job. So solve that problem first on the intake before we go, right, investing hundreds of thousands, tens of thousands on solving okay, we have a bot that'll call on denials. I'm like, why don't we just prevent the denials, right? Let's go upstream. So I just wanted to throw in my 30 cents there on, when we look at healthcare and problems to be solved, I challenge people on where they're looking to solve that problem. It's a legit problem, but is it the problem we need solved?
Right, absolutely. A lot of things you just mentioned, denial, basically the canceled of appointment and everything, the schedule, I would say the smart scheduling. When we talk about smart scheduling, these are a lot of things you can proactively trying to dynamically find out how to fill in those slots. A lot of time you have to be really being creative, how we can utilize those slots, not to, I would say, mention time, wasting time or stay idle, and how we're going to convert those empty slots, meeting in person, changing to virtual care, or changing to other type of services. So still billable, but at the same time, we are not, leaving it unutilized. So these are a lot of things that when we understand exactly what business we're running, we can understand how these things can be creatively measured and also managed by a smart scheduling system. And when we do smart scheduling, there's not just one-sided. So you have to basically communicate fairly well with patients and also their care teams, and also predict whether this patient is SDOH, maybe they cannot afford or cannot have issues of transportation, issues of, take baby care, a
Yeah,
lot of other things you have elements
absolutely. Yeah.
as well. So you can, proactively prepare for those challenges. So, creativity is important on smart scheduling at the same time with a lot of other things to work in between physician and patients together.
Yeah, you just made me think of some, there's a lot of research on there. You just made me think of something with the smart scheduling. I want to take this a little further. Is
Hmm.
in physiotherapy, and I know there is in healthcare, there's data on why people cancel. And what I always
Hmm.
challenge, and then what I say is people are going to see why they schedule, and there's these data points. And then people
Hmm.
say, well, we're not going to schedule those people or we'll double book them. I'm like, we're not saying why they didn't schedule. We said, who didn't schedule. It's not why they didn't schedule. And so
Hmm.
back to your point, so if we take these data points and plug them in up front, and we have maybe, right, again, I think ambient AI again is more powerful, just going to say it
Yeah.
out loud, at the scheduling time than it is in the provider room, because if I use it, then the people on the schedule will show up. And
Right.
if we have some of that data filled in on the front end, and it
Hmm.
says the likelihood of this person not arriving is increasing, then it's going to challenge either the AI or the person using the AI on the call to dig
Right.
deeper and to figure out how can we get. And I think a great example you used is we in healthcare, we force everybody to show up physically. But with telehealth, with telephones, if I see the increased likelihood of arrival going down in the clinic, I can then start to offer telehealth. If the Now, if
Absolutely.
the doctor is scheduled for a telehealth slot versus in person and they have that visit, success.
Yeah.
Yeah.
Yes,
So
absolutely.
using that data more upstream and to solve the problem before it happens, right?
Right, exactly. And that proves like how telehealth is going to fundamentally change no show is during pandemic. So
Yeah.
during pandemic, especially behavioral health. So the behavioral health no show like in-person visit is very, very high, you know, um, significantly higher than
Yeah.
regular
Than
per
regular healthcare. Yeah.
service. Yes. But during pandemic, we changed behavioral health into virtual care. And I think the no-show rate is the lowest of all healthcare. It go from one spectrum to another. So that just tells you the virtual care is really much needed in this time and also in a lot of really improve patient experience. And a lot of patients these days trying to find doctor provide telehealth. And if you don't have telehealth, I think that's actually a disadvantage.
Yeah. And again, I think it can be, you've said this terminology, it can be a tool that
Right,
someone has for scheduling. How would you like to meet with your provider?
right, right.
And because we talked about, and you brought up, the mom, the scheduling, we got daycare, we got all this stuff, and you're trying to cram someone into a space. All of a sudden you take this person who wants to see a provider, who needs to see a provider. You hear their mom, you hear you're trying to schedule them, and you say, you know what? I got another option for you. And magically now, again, everything aligned. You have them. If you force them on the schedule, they're going to no show or cancel. If you put them in
Right.
the telehealth, they show up. And the provider, again, I call it, by the way, I call it preventing the downstream chaos. Because if I schedule them in the clinic and they don't show, now the chaos starts. We start calling people. We start trying to fill slots. Provider didn't expect this person, right? So this is where I see so much of this value happening so that the provider is set up for success. And yes,
Yes.
we'll have AI in the room, but they'll be with
Yes.
the right person at the right place at the right time.
Yeah, absolutely. You're absolutely right. And a lot of times these days we have very, very many new applications. The Amazon, mini clinic, you can walk in. There's a ZocDoc, you can sign up on, cash payment. So a lot of doctor actually, they have many other options rather than just focus on healthcare, focus on certain network. So if they can utilize their time well by helping others, some of the people might be traveling to your city, they probably temporarily has no healthcare insurance and they want to be just cash payment. And those people, if they truly, in needs of healthcare, I feel this is a win-win situation. So a lot of these situations exist. So, we just need to make sure these information get shared, and these will come subsequently on my LinkedIn post as well, is how to overall improve healthcare space or health overall, just for the future generation, which slightly different from Gen X, Gen Z are different from Gen X,
Yeah.
millennials. They all have their own different lifestyles. They're dynamic. They travel a lot. They're digital nomads, and they stay in one company for a very short period of time, and then they went to another company. So they don't want to keep switching doctor, or they want to see no doctor at all, and how they're going to get their care in time, in timely manner, and really how we're going to work in the situation to fit their needs. So all these things are going to be coming up, and it's slightly different from what we get used to.
Yeah, absolutely, absolutely. I think, yeah, that phrase I made, right person, right place, right time, right? I learned that phrase. I actually did some research on it. It popped up in the late 1990s, yet it was being used earlier. But that's what you're describing, right? And that's what we're talking about here. And I've doubled back to this term now when I talk about where we are today with AI and tech. It should facilitate, and the end result of this workflow, of this process that I've put together, should be right person, right place, right time. So again, when the doctor sees a 10-15 telehealth visit with Jane Doe with this diagnosis, that's where that person should be. This is the doctor's expertise. They have a need that the doctor can fill. They didn't have to be put on the schedule. They know the cost, all those things. We can't lose
Right.
with that. We can't lose. We can't lose, right?
Yeah,
And I
absolutely.
see AI really facilitating all of that right person, right place, right time. And then again, even the right? So now the communication, this patient engagement again. Hey, Jerry, right? Did you do your exercises today? Hey, Jerry, don't forget to take your medicine today, right? And we're going to see
Right.
compliance go up, right?
Right. And if we talk about outside healthcare, there's a whole lot of opportunity we can do to make us, our generation, and future generation much healthier. At least they can make informed decision at all time, because the information will be available to them. And not to mention, they will have a personalized assistant, I would say health advisor, with
Sure.
that information to provide them the best solution or best suggestion, so we can take action to make our life better and to make us more healthier down the road. So a lot of people here already, developers already generate a lot of good ideas to build health, I would say health applications or health AI, we call. So target these area, and the whole community we call biohacking. They trying to slow down aging, and these are all existing right now for how we're going to utilize the new technology, utilize the technology progress on, genetic, pharmaceutical, on the way we live our lives, on how we're going to do our exercise, knowing our history, genetic history, and how we're going to prevent it from happening, and what's supposed to be the best proven results out there. Utilize the whole world information, not just siloed
Right.
USA.
The silo, breaking down the silos finally. I've been in
Right,
siloed healthcare for 33 years, right?
right,
Nobody knows what's happening on the other side of the wall, right? From the
right,
office.
right. So alternative medicine, Asia, Middle
Hmm.
Eastern, we have a whole legacy in this whole world on different culture. I would say remediate a health issue in a different way. So all these information will be at the fingertips of future generation, and they can make decision on
For
themselves,
themselves, right? Yeah, for
for
them.
themselves on their own health. I think
Right.
that will be a beautiful world, right?
I don't know. That's what I hear everybody saying, whether we all disagree, right? But that's what everybody's saying on both sides of, or all three sides or 20 sides of any argument, right? Is giving people the choice, right?
Yes, yes. And also I think a lot of things will go beyond our discussion is how we truly want to empower ourselves with the information that we know, whether we want to do it, we not to do it, self-discipline, we skeptical ourselves. So a lot of situations that is also come with trial and error. So it's going to be interesting, but I think fundamentally in the future of healthcare, I will firmly believe our human will get healthier and healthier, will live longer and longer.
I'm going to state that's right person, right place, right time, because part of that equation I always say is right person, right place, right time. The right
Yes.
place is not necessarily with you when they're calling to schedule an appointment, right? So how will
Right.
I say, hey, Jerry, you don't need to be in the office today. Hey, Jerry, I can send you some information. We have a communication tool, right? And then it
Right.
does exactly all those things you're saying. It helps you to set up your own program. And so
Right.
I got you by saying no, I got you
Right.
to the right place at the
Right.
right time, right?
Yes, absolutely. So it's a lot of things. I find so much similarity with this supply chain, just in time type of methodology, or really, I feel like working Toyota really gets it done because they figure out inventory is really killing them. Really killing them on margin, killing them on operation, many other ways.
Yeah.
So they figure out how to do just in time. So I feel it's
Yeah,
very,
I like that just in time. And in my space, so in my world, in the physiotherapy world, it shows the sooner you're like this, just in time,
yes,
the sooner or more upstream, I like the term more upstream, we get to people with low back pain, the less everything, right? Less
yeah,
costs, less pain, less disability, less lost days of work, right? All of that, the
absolutely.
sooner we get to people. So, right, just in time.
Yeah, yeah, absolutely. I think timing is very much important in many people's lives, in the way we do business, in also in various enterprises to make sure how they run so effective and efficient. Timing is extremely important factor.
Yeah, and that's why I said I know you're in healthcare, but you're not that provider background. Because when you get outside of the provider space, then you start to have more conversations like you just brought up.
Yes,
We start to talk about the biggest influence on my journey in healthcare was when I went outside of healthcare to learn more,
yes,
and I joined an entrepreneurs organization, and I was in a
yes.
room with no other healthcare people, and I learned how to go back to my business and better serve the people I wanted to serve, my patients, right?
Yes,
Yeah.
and my previous organization, ThinkCare, we're a provider-led organization, so we run value-based care as well. So if you know value-based care, there's a lot of incentives, a
Oh
lot of
yeah.
things that you have to hit the mark, and also depends on how you hit the mark. So the money can be variation. So we don't want these provider leave money on the table. So we use AI, use advanced analytics, and give them business insights. And we talk about just in time, the right time, with the right information, and to really let them to understand how they're going to drive their business outcome. So how you're going to improve their care quality, and as well as how they're going to make sure that a couple of measures are important for them and to hit. And those important measures, what is the difference is going to see on your balance sheet, on your paychecks. So these are also a big utilization for advanced analytics and AI in a value-based care space.
So when I talk about AI doing, by the way, I didn't say the word yet,
Mhm.
I see right person, right place, right time is a AI enabled team member, not a provider, upstream doing triage, right?
Right.
So
That's
just in
so,
time, right place, right time. Again,
yes,
with the AI enabled
yes.
tools
Hmm.
to tell me who does not come from healthcare, yet I've been set up for success through a process, again, where I've access to information, right? And the ambient AI is hearing the conversation and telling us what direction we need to go. And then again,
Yeah.
the option of doing nothing. That's funny. Healthcare, healthcare never considers the option of doing nothing, and doing nothing is a solution many times. So of doing nothing, of doing a phone call, of doing a telehealth, of doing an in-person, and doing that again further upstream, like we're saying in supply chain.
Right.
That to me is where this is why I keep saying that AI before they get now. If they need to get on the phone with the provider, if they need to do telehealth, then that information flows down. Yet I would argue this process is going to keep more people out of that space. So therefore, I come from the provider side. I'm like the biggest value here isn't in the provider space. It's to make sure the right person is in the provider space. That's where
Yeah.
I really am spending all my time in trying to learn more and more about with AI and how can we facilitate this, right?
Yes, and my previous organization, when I building all these solutions with AI or not with AI, is truly to understand again providers' pain point, and a lot of these systems are designed with provider together. So we have to come up with a solution, and based on what is their expected outcome, what they feel, what is matter the most. So from that to start with, and then come down to really they care what they care about. They care about paying on time, get paid on time, free some really time space so they can do less admin work, and also they have to, if value-based care, do they know care coordination? Do they know their patients well? Do they know who always have readmission to a hospital? And also another thing is how the care coordination does, and how the truly their measure, how they measure where their KPI at every single time. And we are not wait until the last minute, but also telling them what's the trends, so you can prevent some of the things from happening, so you can get better measurements or better results. So these are all the system I designed with physician. So physician can not just adopt very well, but also truly change the way they work.
I call it becoming a solution to the problem. There you go. That's what you help people do, become a solution to the problem. I love it. I love it. See, we could have never done this in 30 minutes. We got to the value based at like 35 after. So I was like, oh no, we can't stop now. When you I heard that early on and I was like, oh, that, because in my opinion, and my belief and biases is we all have to shift there. All of us, right?
Yes, I
There
think
was,
the future is coming. It's not coming in near future. I feel future is here now
yeah, the
already.
future is here now. I love that. Yeah, I say the future is today. So I always say the future, which is today, right?
Right.
So, but
Yes.
if everybody who hears this just takes on the mindset of everything you just shared and whatever they do, and see, this is what's interesting. We're talking about AI and tech, but yet everything you've shared, Julia, is how we should be thinking as healthcare providers, as leaders in healthcare, as team members. The other thing, and I'm glad you said it, and I know most people have heard my stuff. No, I love to get, everybody says, oh, you're the front desk guy. I'm like, but there's more value when everybody's in the room. I love getting the front desk team, the management team, the provider team, and the back office team, because I want everybody in the room to understand that if there's a problem be solved, I want everybody to go around the room and go, how does this problem impact you? Where do you see this problem? How do you see this problem? And then we can create a better solution. And back to your point, then we could create better tech. We can create a better AI tool when
Absolutely.
all team members, I'm not going to say all stakeholders, all team members are in the room. And by the way, then we got to consider the patient side, right? Which I didn't even mention.
Yeah, absolutely. You just mentioned change management
Oh,
101.
yeah, right. Yeah. Which you
Yeah.
probably know a lot more than I do about,
No, but this is very good. It's a foundation of everything.
right? And we
Yeah.
forget that. And us in healthcare and providers should all be educated. We should all require an undergrad degree in change management before we even go learn the healthcare side of it.
Yes.
But that's for
More
another
so
conversation.
ever.
But I
Yeah.
love that. Really appreciate your time and your sharing and your patience with all my questions and statements. It's this has been very enlightening, and I'm looking forward to more of your post. I'll make
Okay.
sure I'll make sure I get your LinkedIn link to your LinkedIn into the show notes so people can come find you on LinkedIn. Because again, I think there's great value in the way you're presenting technology and AI as it applies to healthcare. I'm going to say just at a little higher level, right? When people get too far in the weeds, I'm done. I'm out. Because, right, I need your higher level content alongside of some of this other stuff. So I really appreciate the work you're doing. And that's what led you on the show. So I really appreciate your time here.
Thank you, Jerry, for inviting me. And all my trying to do, my mission is to help, I would say, healthcare organizations, small, medium size, especially healthcare organization, not necessarily limited to really, adopt this technology and make some huge differences, impacts, as well as being successful. And I'm here to help. And I'm very glad we have this conversation. I'm looking forward to our next one.
Yeah,
And
right. There can be more. I promise you, there'll probably be more. I'll probably see a post and say, you got to come on and discuss that post back on the podcast. And we'll do that. That'll be great. Now, don't hang up. I'm going to hit stop, but I'm going to thank you again. And I want to double down on what you just said on the organizations you help. What I love is so much of what you shared is that change management thinking and structure and systems thinking and process. And that's what leads to the success. It's not, I have the AI platform, right? Everybody's like, do you have it right? You know what I mean?
yes,
So
that's exactly it.
again, all your insight and all your knowledge is so valuable so that people can put the right processes and systems in place that have automation and tech involved. And that's the way you led off. And if anybody who sat through this, you heard your expertise in that. So again, thank you very much.
Thank you, Jerry.